My talk today is about the use of red blood cell transfusions and platelet transfusions in MDS patients. And we conducted a survey of MDS patients in the real world of over 450 patients, asking them any one of 52 questions about how they're transfused, how often they're transfused, what would improve their quality of life. And some of the key take-home messages were that a large number, 75% of patients were receiving non-same-day cross-matches for their transfusions, which means they have to make an extra visit to the hospital on top of their actual time-consuming transfusion. And the majority wish they could have a same-day cross-match. So that was one that could improve their quality of life. The second point that patients endorsed, according to questions we asked them, were majority wanted to have point-of-care testing of their hemoglobins at home as an option to identify the hemoglobin threshold at which they're appropriate to receive blood before they become significantly symptomatic, because many patients are enduring symptoms of fatigue and dyspnea and decreased physical functioning for up to 5 days before they can organize a blood transfusion. And finally, 40% of our patients wished they could be transfused at a higher hemoglobin threshold than they were actually being transfused by their physicians, who were being very conservative. And 40% of the patients were being transfused at hemoglobin thresholds of less than 75. So I believe, at least in the context of some clinical trials that we are conducting, that the UK group has conducted, that there's some evidence that transfusing to higher hemoglobin thresholds may improve quality of life, but it requires larger studies.